Hi, I'm Steve Rowe, CEO at Oaknoll. I'm recording this video the afternoon of Thursday, March 20th, and it will be uploaded and available for you sometime on Friday. We have good news related to the influenza cases that have been reported on over the last couple of weeks. We seem to be past it. No new cases have been reported in either assisted living or in the health center this past week. And I really want to thank our environmental services team for all the extra care and attention they've paid to wiping down kind of common area surfaces, any of the high touch areas where germs can easily be transmitted. The EVS team has just done a great job of keeping on top of that. And we've really seen the worst of it, we hope. We have not had any new cases recently, and we're not aware of any cases any place in independent living at the moment either. So hopefully, it's like as we head into spring, it's like we're behind the worst of the influenza for our community. My workday started at 4:30 this morning when we called an Uber ride to the airport in New Orleans. A small group of our staff was in New Orleans to visit a community that operates 6 small house nursing homes. The community is called Poydras Homes, and it really is located in the heart of New Orleans. Poydras Homes uses a model of care that is called the greenhouse model. That phrase is trademarked, so as we have talked about our small house, we have been intentionally not saying greenhouse, but the philosophy and kind of the general idea is very similar, and we are actually at this point considering going through the process to be a registered greenhouse community. I don't know if we'll do that, but this trip really made us at least think differently about the possible benefits of doing that. I was with a small team of people. The group that was on this trip with me, I included Amber Jedlicka, our Director of Health Services and Administrator, Sarah Ruhlman, our Director of Nursing, and Taylor Wheeler, our Assistant Director of Dining Services. And we had the opportunity to tour the Poydras homes. As I said, they operate 6 small houses, and it's kind of a unique setup. They have a 3-story building with a 12-unit small house on one side, a common area space that includes an elevator in the middle, and then a 14-bed or room small house on the other side, and it's 3 stories in one building. So 6 different small houses, each operating fairly independently of each other in terms of the residents that they serve and the staff who work in those small homes. There's a little bit of overlap from one home to the next, but the primary assignments are this person would work in this house or this house and not really kind of float between them. This trip came at a really good time for us. We're within a few months of opening our small house model of care across the street, and we're at the point where we really need to nail down how we are going to staff it and start to get people hired and trained into their new roles. And the primary thing that is different with this model of care is that it is not kind of a functionally based where you have a certified nursing assistant that is doing the direct cares with the resident and a EVS tech who is cleaning the room and a recreation aide who is coming in and doing activities with residents or doing group activities, things like that. It is all of those functions happening within a small team of people that are really providing care and assistance to the residents in that home through the course of the day, regardless of what the need is. So minimally qualified as a certified nursing assistant, but then with training to cook, to serve meals, to do recreation activities, to clean, and really it's like their staffing model is they have 3 what they call care partners who are responsible for the 12 residents within that home, and then they have a guide that is kind of the coordinator or overseer of the home for scheduling and training staff and hiring people. The guides also have some kind of functional expertise. So one of the guides that we talked with, his functional expertise was he used to be a restaurant owner, a chef, and a couple of years ago he started working for Poydras Homes, and he's responsible for the dining operations across the entire 6-home operation, but then he is a guide for one of the homes as well, kind of that go-to person for the care partners. We were able to participate in a panel discussion with the care partners, the guides, a nurse who kind of oversees the clinical care for 2 homes. So the nurses have responsibility for 26 residents that they're providing nursing services to. The director of nursing, the administrator, and even the CEO was part of that panel conversation. And it was just really, really helpful to see it live in person, to witness, the interactions between the staff members who are working there and the residents who they're serving, and then to spend time together as our small team, kind of debriefing what we saw, thinking about and dreaming about what we are going to create for our small house. So, trip came at a really good time. There's a lot of work that we need to do over the next couple of months to prepare and get us ready to start serving residents, hopefully in July, assuming that construction finishes by the end of May, as we have continued to be told. So we'll trust that is correct, and our goal is to be operational in that new small house in July. So if you have questions about that, I'd love to talk with you. It's like we're going to keep working on figuring this out, and we need to start hiring people and training them in this new role. So that will be happening over the next couple of months. The other thing I want to talk briefly about is a proposal that was brought to me in early March, and it was a proposal to pilot the idea of fostering cats here at Oaknoll in an apartment. I told the people who brought the proposal to me that it's like, while I could make that decision myself, I did not want to make that decision myself. I wanted it to have input from resident council. So in last week's resident council meeting, we shared the proposal that had been presented to me. I gave everybody a copy of that. We had a conversation about it, and generally there was support for piloting the idea of within the council. Since the resident council meeting minutes have come out, I've heard from a small number of residents who have concerns, most typically allergy concerns with cats. And I just want to assure you that if you are somebody who has either concerns about cats generally or allergies specifically to cats, the place that I'm thinking about for piloting this foster program is a place that you would not have any interaction with the cats. There is an open apartment right now that I just recently signed a contract for somebody who's not going to be living in that space. On one side of that apartment is an office. On the other side of that apartment is a laundry room, and across the hall from that apartment is another office. So if you don't want to have any interaction with the cats, I don't think you will even know that they are there. And if you do, when we get cats, we will certainly let you know. We'll most likely have a key-coded lock or a number-coded lock on that apartment so that people can get in and we don't have to distribute 1 million keys for the people who are going to be part of that program. But that is in the works. If you have concerns, I would just ask you to let us try it. Let's see how this works, and I do believe that we will be able to do this in a way that has very little to no impact on the people who don't want to have anything to do with cats. So that is pretty much everything I have for you today. I'm kind of tired. I hope I made sense in what I've communicated, and we will see you again in a couple of weeks. Take care.